So now let's talk about bipolar disorders. This is just a visual. If we're talking about cyclical types of bipolar disorder, it's you can imagine a roller coaster. You're going high and then you're going low. And if the line is a typical mood or somebody who's kind of feeling neutral or normal, you can see the highs are mountains and the lows are valleys. Somebody who's manic experiences lots of highs. Somebody who's depressed, you see experiences lots of valleys or lows. And normal, we have sometimes where we feel a little better and sometimes where we feel a little worse. And then the visual below shows you a really nice visual of bipolar depression versus unipolar depression. And the unipolar is the red dotted line. So here's a visual of how bipolar and related disorders are broken down. You can see to your left is bipolar 1, bipolar 2, and then on your right, cyclothymia. So bipolar disorder is a mood involving mania and possibly alternating with depressive episodes. So the reason why bipolar disorders have their own chapter now in the DSM-5 is they've found that bipolar disorder is significantly different than the depressive disorders, and that it's more strongly linked to psychotic disorders like schizophrenia, spectrum disorders, with family history, the type of symptoms, and the genetic links. A person with mania sometimes suffers from depression, usually does, although there are some people who just have a normal mood and then manic episodes. Manic episodes are defined as having racing thoughts, hyperactivity, being easily distracted, having a great sense of yourself. A person may hear voices, they may be highly energetic, they may have an increase in activity or energy for at least 1 week. There are 3 types of bipolar disorder. Bipolar 1 disorder, 1 or more manic episodes and maybe depressive episodes. Bipolar 2 is 1 or more major depressive episodes and at least 1 hypomanic or mildly manic for 4 days episode. So hypomania, hypo is a prefix for under, means a little less mania. Cyclothymia is a more chronic, low-grade bipolar disorder. It's like the dysthymia of bipolar disorder. And there's an excellent film that looks at 4 different people with bipolar disorder, and you can click on that link below and watch a little bit about how it's an old film, but it's absolutely excellent. About 1.6% of the U.S. population is diagnosed with bipolar disorder. The first episode for men is usually manic when they seek treatment, and the first episode for women who seek treatment is major depression. After a single manic episode, 90% of people experience a subsequent one. Under 15% have 4 to 8 mood episodes in a year. These people are rapid cyclers who go up and down, either in a few weeks, or some people it happens on a daily basis. So cyclothymic disorder, like I said, it's where a person has that it's not as intense, but it's more lower grade and chronic, at least 2 years. And they alternate between feelings of productivity and creativity and moodiness and irritability. Here's a nice chart that compares the 3: bipolar 1, manic, and possibly depression, bipolar 2, hypomania with depression, and cyclothymia, hypomania with mild depression and 2 years or longer. So what are the causes of bipolar disorder? There's neurotransmitter dysfunction, although we're not exactly quite sure what it is. It could be serotonin and norepinephrine. And your book talks a little bit about the catecholamines with norepinephrine, so you can read about that. There's a high level of genetic inheritance, specifically on the PCLO gene that creates synaptic transition problems. What are treatments for bipolar disorder? Okay, so let's first talk about the biological treatments for bipolar disorder. So there are a number of medications that have been found to be helpful with bipolar disorder, and those are the mood stabilizers. However, if somebody goes to seek treatment when they're feeling depressed, they may be misdiagnosed as having depression and put on an antidepressant. Antidepressants have been known to trigger or cause mania in people with bipolar disorder. So that's something to be aware of, that if you or a loved one seems to be having an adverse reaction to an antidepressant where you start doing some crazy things, are really acting out, it may be triggering a manic episode. But the mood stabilizers are anticonvulsants, which were originally given to people with epilepsy, but they were found to help people's mood. Lithium decreases the catecholamines in the nervous system, but they have side effects where you can have intoxication with lithium, so you have to have your blood levels checked, and I've noticed people sometimes shake, so there are some side effects. There are a number of things that are currently being developed. The neurokinin receptor antagonism, the NMDA receptor antagonists, the GCC receptor antagonists, and the nicotinic receptor antagonists. And the last one is actually being studied at the Lindner Center of Hope. Other biological treatments include electroconvulsive therapy, which is also called shock therapy. It can save people's life with severe depression, and it's especially effective in patients over age 60. It's administered until a person's mood returns to normal, and usually people need about 6 to 8 sessions. I recently got to observe an ECT treatment at Good Samaritan Hospital in Cincinnati. And they have made it much more humane than what we see in the movies, but it lasts just for less than a minute or so, and the person essentially is given a seizure, and now they put it's just less invasive and less problematic as before, but many people still do report memory loss and some problems. So there's also behavioral treatments. Again, you want to increase positive experiences, learn new social skills to improve your interpersonal skills, and the more you can strengthen positive things in your life, the better you're going to feel. Cognitive restructuring is also very helpful with people, so we've already talked about that. And your book talks a lot about interpersonal and social rhythm therapy, and this type of therapy addresses 4 areas. It addresses people's non-adherence to medication. Because bipolar disorder is such a biologically driven disorder, it really has its underpinnings and biological causes. It's really essential to take medication. Exploring people's feelings about having this disorder, getting education about the disorder, and a real focus is helping people establish routines to increase stability and a rhythm, so that people have a schedule that they used to, they can expect, and that helps to really stabilize people. To learn more about ISRT, you can click on the video link right there.